Good afternoon. This is Mr. McKeever coming to you on Thursday, July 8th, 2021. And this is a recording for the PTA200 final exam review. There will be a short review, Kahoot, quiz, whatever that I can post up once I'm done here. But in the meantime, this is just kind of the lesson talking about what types of questions you might encounter and giving you just a general idea and overview of what to expect on the final exam. So just to let you know, the final exam itself at this current time is 75 questions. So it's 75 questions total in length. I'm probably going to move that up to 100 because I want to make sure that there are 100 questions on both exams. So what to study for this exam? Well, I mean, I could make this easy, make this really hard for you guys and just say that, well, you know what you have to study is kind of everything that's in your PTA 200 class, right? But I'm going to try to be a little bit more specific so that I don't get yelled at by some of you for saying, we'll just study everything. So looking back through the lesson plans and looking back over the past several weeks as we've gone through this, actually almost what, a month or 2 months or now, or 3 months, I don't even know what we're at. Some of the things that are going to be important to study for the kinesiology exam. First of all, that entire first lesson on Intro to Kines, where we went over locations of the body, right? Lateral, medial, superior, inferior, cephalid, caudal, where we went over the positioning for anatomical position. So I could give you a question on asking how to place a patient in anatomical position, stuff like that. Also looking at the ideas of the arthrokinematics versus osteokinematics, right? Osteokinematics are what we measure when we do goniometry. Arthrokinematics are those accessory motions of the joint that help us when we're doing joint mobilizations. Looking through stuff like that, looking at all of the general motions, right? Where does plantar flexion occur? Where does dorsiflexion occur? Where does internal and external rotation occur? The different types of bone and structures of the bone and also muscles in order to allow for movement, the different types of joints, fibrous, cartilaginous, synovial, those type of things. Where you might find syndesmosis joints, right? Obviously, there's a couple places you can find syndesmosis joints. What is a bursa? The end feels. There are quite a few questions on the end feels. So know your difference between the normal end feels, you know, bony, soft, and firm, versus abnormal, like empty, hard, abnormal soft, abnormal firm, boggy. Knowing all of those. Understanding the convex concave rule. Please understand that very, very well, right? Convex, right, will roll in the opposite. Concave will roll in the same, right? You always remember that you want to put one direction in a cave, right? So in the concave rule, they roll in the same direction. But remember, with questions like that, the first question you have to ask yourself, get out a sheet of paper when you're taking the test and go, what joint is moving? Which joint, which limb, what part of the limb, right? So if I'm asking questions about the arm, is it a bicep curl? Or is it a push-up? Sorry, my brain was kind of melting there. Know your kind of types of muscles, right? Where is the bicep located at? Where is pecs located at? Those type of things. Not much on simple machines or anything like that. Know the pelvic tilt postures. And then that leads us into posture itself, right? With posture itself, you need to understand basically, and again, not in depth, but really kind of basically where, if we do a vertical plumb line in order to assess posture, where that vertical plumb line should fall, right? So, you know, in the kind of where does it fall if it's lateral, where does it fall if it's anterior? Anterior should fall right through the middle of the body. Lateral, it should kind of fall out there through the auditory meatus, through the tips of the acromion, through the bodies of the thoracic, just anterior to the bodies, thoracic vertebrae, through the vertebral bodies of the lumbar vertebrae, and then through the greater trach, posterior to the patella, and then anterior to the lateral malleolus. So paying attention as to where and how those lines pass. Be aware of that. There aren't going to be any questions where you actually have to assess someone's posture in there, but there may be a question of, what type of a postural deformity like scoliosis. What could that possibly do to posture? Well, obviously, if you get a scoliotic curve, you're going to try to overcorrect in other places in order to compensate for that scoliotic curve. And then we have gait, right? An abnormal gait primarily, right? Know your different RLA versus traditional scale. Know your RLA versus traditional scale. And then go through the abnormal gaits. You're not going to have to know the muscle specific or the motions of the joints at the specific areas. But I mean, it should be pretty simple if I ask you what muscles are going to be most active during swing phase, that your hip flexor is going to be active, right? Because it's starting to bring the leg through. Or if you're in toe off, how should the gastroc be, right? Well, if you're in toe off, you're getting ready to push off on the toe, the gastroc should be fairly contracted at that point. Understand the difference between a child's gait and an adult's gait. What are stuff that could cause abnormalities in gait, pain, surgery, stuff like that. And then know those abnormal gait patterns. And when I say know those abnormal gait patterns, you should be really, it's not, I know I'm making this way over simple, but understand that if I've got quadriceps gait, I'm leaning over my quadriceps. If I've got gluteus maximus gait, I'm leaning over my glutes. So what could cause those? Well, those could be neurological dysfunctions, right? Or it could be that I've got a tightness and a weakness, right? If I'm leaning forward over my quads are tight, and my hammies maybe stretch weak. Those type of things are what you need to know about it. Be aware of like your neurological dysfunction gaits, spastic gait, such as scissoring gait and gastroc gait. So that equinus gait we talked about yesterday. Ataxic gait, where the patient's having problems implementing the motor plan. And then bradykinesic gait with Parkinson's. Also be aware of what a pronator versus supinator is when it comes to walking, right? Pronators walk on the insides of the feet, supinators walk on the outsides of the feet. Know your techniques for both true and apparent leg length. True leg length, ASIS to medial malleolus. Apparent leg length, belly button to malleolus. Know the difference between a non-weight bearing pattern and a partial weight bearing pattern versus a full weight bearing pattern. They're self-explanatory. How do I ascend stairs if I have an assistive device? Well, that can be challenging, right? You have to know what the assistive device is. But you always go up. You always go up with the good leg and you come down with the bad leg. Good goes to heaven, bad goes to hell. Just remember that. Know the difference between an MRAD and an LRAD. And then know your progression of safety of assistive devices. Parallel bars to walkers, walkers to crutches, canes, hemi-walkers, and other things like that. So know those kind of safety devices. Understand if I ask you what is the most safe device to ambulate a patient in, that parallel bars is the answer. And then we talked about the principles of goniometry, right? Know the difference between passive range of motion, active assistive range of motion, active range of motion. Know those like inside and out. What are we measuring when we're measuring goniometry? We're measuring the osteokinematics, right? Understand the difference between a capsular versus non-capsular pattern. Main idea there is capsular patterns, we mobilize, Non-capsular patterns, we stretch and strengthen. Know your capsular patterns, primarily of, I said again, the shoulder, the hip, and the knee. Obviously, if you're bored, you need to know all of them. But the shoulder, hip, and knee are the main ones. Please know those. And then know what the tool is we use to measure goniometry. It's a goniometer. I hope you got that. That one should be easy. What are the steps to doing goniometry? There's a 12-step sequence, right? Know those 12 steps. Remember that you always want to STD with the patient. Show, tell, do. Know your manual muscle testing grades. 5, 4, 3, 2+, 2, 2-, 1. 5, maximal resistance. 4, moderate resistance and brakes. 3, full against gravity. 2+, partial against gravity, full gravity eliminated. 2, full gravity eliminated. 2-, partial gravity eliminated. 1, trace. 0, nada. Remember that you want to place your resistance more proximal so as not to lengthen the lever arm. And then we started going through the joints. So you need to know the hip, including all the muscles and bones. Those don't go away. You need to know the active range of motions of the hip. So 120, 30, 45, 30, 45, 45. Flexion, extension, abduction, adduction, lateral, and medial rotation. Know your walking on level surface requirements. You're not going to have to know the ascending stairs for this. The ascending stairs usually you want to know for the knee. And then basically know your essential goniometric landmarks for all your joints. They're pretty simple, right? The hip, greater troch. The knee, lateral epicondyle. The ankle, lateral malleolus, those type things. Then we've got the knee, know all the bones and muscles of the knee again. Know what makes up the pes anserine. The big question your boards like to ask. Know what the terrible triad is. With the knee, again, know your capsular pattern, and then know your full range of motion, 135-0. You do not necessarily have to know the rotational component, but know there is some rotational component of the knee. The ankle and foot, we got all kinds of fun stuff down there to know. Know the difference between the forefoot, the hind foot, and the midfoot. If I give you a question on the ligaments in that of the foot, it's going to be fairly simple. It would be something to the effect of, which bones do the anterior talofibular ligament connect? Talofibular, it's in it. Where would you find the talofibular ligament? Would that be medial or lateral compartment? Know the difference between an inversion and eversion strain. Know your bones of the foot. Right? Know that you have your calcaneus, and on top of the calcaneus is the rider in the boat. That's the talus. The talus itself goes down and floats in the boat of the navicular. The navicular then floats in the milk. Medial, intermediate, lateral cuneiform, along with cuboid. Know your plantar fascia. What kind of problems occur with it? Know your joints, 20 dorsa, 50 plantar, 35 in, or 35E, 15 in. Don't know so much about subtalar. Don't totally freak out about that. Then for the shoulder know all of it. Better know all of the joint motions. Again, for the shoulder complex, there's no goniometry. Understand the idea of the force couple. And then also really remember that rotational component, that for every degree, for every 2 degrees, the arm goes up in shoulder flexion and abduction. The scapula rotates 1 degree. Then for the glenohumeral joint, again, know all your bones and muscles. I know I'm saying all of this like it's common knowledge, but you should know all your joints and justles. joints and muscles from now until the end of eternity. Just saying. Know your range of motions of your shoulder. So flexion 180, extension 60, medial lateral 70, 90, or sorry, 90, 70, and then abduction 180. Shoulder joint should be the only one you hit 180 degrees with. Know what the position of apprehension is. Position to test for shoulder dislocation. Elbow, wrist, and hand, all the joints and bones, right? Know your goniometry of that. Know your carpal bones, all that fun stuff. And again, elbow, wrist, and hand, the main thing is know your elbow inside and out. Thoracic and T-spine, or C-spine, T-spine, L-spine. Again, major idea is know your bony landmarks for that. Know the difference between scoliosis and kyphosis and lordosis. Know your general ranges of motion. And then also know which joints allow the most degrees of freedom in the cervical versus thoracic versus lumbar, right? Oh, also know your discs, meaning what's a normal disc look like? What's a degenerative disc, prolapse, a extrusion, and a herniation sequestration look like? Then for joint mobilizations themselves, understand the grades. Understand why we do the joint mobilizations. There aren't going to be specific questions on positioning to put a patient in for a joint mobilization, other than you should know that the position to put them in is open pack position. There's not going to be a specific question asking you how to do talocrural distraction or anything like that. It's going to be just asking you to what position would you put them in. And the last thing we talked about was special tests yesterday. Know those first couple slides inside and out. Specificity versus sensitivity, inter-tester, test, retest, and then validity versus reliability. I did list some specific tests that are out there, but when I give you a question on a special test, it's going to be pretty obvious what I'm asking. I'm not going to be asking you how to perform it, but I may ask you why you might perform a special test. Well, special tests are usually performed to rule in or rule out a diagnosis. So they're not going to be totally difficult questions where you're like, oh my God, I don't understand this, Mr. McKeever, what's going on? They're going to be fairly self-explanatory questions. Like I said, I'm going to try to make this, it's about 75 questions, or just about 75 questions now. I am going to try to make that test be 100 questions because I'd really like each question to be worth 1 point because it is your final. Once I open it up, you will have a week and a half to complete your final. By then, we will be in lab. So that is it for the kinesiology midterm. That's it. I know it's a lot to know and it's a lot for the semester, but that gives you an overview of what you're looking at. I am not going to give you specific questions this time. And your Kahoot may be a good indicator of what's going to be on the midterm or the final, but it is not going to be the exact questions. I'm not giving you them this time. I need to improve your ability to take a test. So that's it for this review. The Therex review will be upcoming. If you have any questions, please reach out to me. Thank you very much.